Hi, I'm Dr Ng Woan Tyng, the President of Malaysian Dental Association.
Hi, I'm Kathiravan, orthodontist and also the President of Malaysian Orthodontic Practitioners Association.
Thank you. The Malaysian Dental Association, commonly known as the MDA, is a non-governmental and not-for-profit organization representing 85% of the dental profession in Malaysia. Inaugurated in 1938, its primary objective is to promote the art and science of dentistry for the benefit of the public. The membership of MDA is close to 6,000, representing almost all the general dentists and specialists from all specialties. Dr. Kathi, perhaps you want to say something on the MOPA?
Thank you, Dr. Ng. MOPA, or Malaysian Orthodontic Practitioners Association, is an affiliate body of the Malaysian Dental Association. So our members have a special interest in orthodontics, and we promote the study and the education of orthodontics. We will also take great care in illegal practitioners of orthodontics by educating the public in matters pertaining to orthodontics.
Perhaps we will first talk about dentistry and its act. Now, Dental Act 1971 spells out clearly that if a person perform or try to perform to alleviate pains or treat any disease pertaining to the human teeth or jaws, he is deemed to practice dentistry, and he need to be registered under the MDC.
So anybody without proper qualification or registration under the Malaysian Dental Council is considered practicing illegal dentistry.
The recently tabled Dental Bill 2017 will not just ensure the safety of the dental patients, but also to ensure a high standard of dental practice in Malaysia.
Stricter regulation of the dental profession and practice with expanded control by the Council and Therapist Board is proposed under the new Dental Bill 2017, which is just undergone the first reading in the Parliament.
Now, first of all, to be registered as a legal person, so one has to graduate from a recognized dental school. After that, he has to go through a year compulsory service with the government, and if he enters into private practice, the premise will have to be registered to the Private Healthcare Facility Act, and there will be a certificate of registration issued. Then annually, the practitioner will have to apply for annual practicing certificate.
So, in short, he has to display 3 certificates in his clinic. 1, registration of his clinic, 2, registration with the Malaysian Dental Council, and third one, annual practicing certificate, which should be displayed in the clinic.
Yeah.
And on top of that, every practitioner's name and his principal practicing place is displayed in the internet in the website of the Malaysian Dental Council.
In fact, you may have heard of street dentists who offered their services in marketplaces or back lanes and even perform extractions and issue dentures. For the last 2 years, a total of 68 cases complained about illegal dentistry, and 41 are actually linked to fake braces.
That's right. Now, in fact, now they are blatantly advertising in WhatsApp, in Facebook, in social media. They are offering these services. For example, we can see beauticians doing whitening teeth or putting veneers. All these are considered illegal dentistry. Definitely, the number of cases are increasing every month, every year. For the statistics part, maybe Dr. Ng can elaborate.
Yeah, okay. For year 2017 alone, there are 2 illegal practitioners. One had been absconded and another one is pending in court. There are 10 cases of fake braces. Out of that, 5 were charged and found guilty and fined to the maximum of 300,000. Another one has been absconded and 4 pending in the court.
This data is from the Malaysian Dental Council, who is the government agency who controls the practice of dentistry in Malaysia.
Well, a lot. Whitening, veneers, removable dentures, fixed dentures, extraction, and fake braces.
I think even extractions, the full range they will do. For example, in this picture, the patient has been wearing braces by illegal practitioner, and as you can see, the condition has become worse than before. So it will take considerable effort of time and also money to rectify the problem and to reverse back to the original condition. Okay, the problem with illegal installation is they just install and then they disappear. Whereas everybody should know dental braces treatment takes a long period of time and regular checkup. They have to come every month. During this every visit, the dentist actually reviews the case and monitors and moves the teeth accordingly. It is not just one-off. Because this one-off treatment done by the illegal dentist, the teeth all move to a wrong direction, and that makes the teeth itself compromised, maybe even prone to more decay and periodontal disease. Besides this, the materials itself that they use are not really regulated. They can buy, we don't know from which source they get these materials that they use. It might not be of the international standard and may cause more harm to the patients. Besides that, there are so many other ranges of problems. Maybe Dr. Ng can elaborate.
Yeah. Infection control. Now, infection control in these premises are often compromised, and the risk of contracting dangerous infections such as HIV, Hepatitis B, and even tuberculosis is always there, and it's not only to the clients but also to the practitioner. Another thing is the lack of medical knowledge among these fake dentists also subjects this patient to the increased risk of morbidity and mortality.
The possible impact can come because of two factors. One is because of the material they use. The braces where they buy from is not really registered in the proper procedure, so it might contain harmful materials that may damage the dental apparatus. And also the skill. Usually the people who are doing illegal dentistry would not have the necessary skill of a dentist to properly regulate the movement of the teeth. That can cause harm to the patient and also maybe even make the condition even worse. So they will, at the end, pay even much more than what they pay for the normal dentist to rectify the problem. In my opinion, I think it's because of the misuse of the social media, where they are free to advertise and to show their friends and relatives and what they are doing, and without understanding the consequence of the treatment. And also these people are more accessible, more well known to them maybe because they practice in a hotel or even in a place where it's close to their home. Another factor will be it's cheap. What they perceive is cheap is not really cheap, because at the end of the day it may cost them even more to rectify the problem. If money is their problem, they can always get treatment in a proper way in a government clinic or in a university or in the army setting, where the cost is much cheaper than the private practice.
Well, I would advise them to seek immediate consultation with a registered legal dental practitioner and abort whatever treatment plan proposed by the illegal practitioner.
Last but not leastly, they have to come forward and report to the authorities. The place that they can go to is the Malaysian Dental Council. The phone number is 03 888 34217. I repeat, the phone number is 03 888 34217, or they can report to the Legislation and Enforcement Branch in the Oral Health Division. The phone number is 03 888 34215. I repeat, the phone number is 03 888 34215.
Lastly, they may also report to the Private Medical Practice Control Branch Cawangan Kawalan Amalan Perubatan Swasta or CCAP. The telephone number is 03 888 31301. I repeat, 03 888 31301.
Or alternatively, even they can report to the Malaysian Dental Association, who will assist them to make this report. Join us in the public forum
In the PWTC Putra World Trade Center, Kuala Lumpur on the 27th January 2018 next year.